Hello, this is Optimum Health For All. I'm your host, OJ Odia.
Optimum Health For All, for all, for all. We're building up strong so we never fall. Mindset, power, we're standing tall. It's Optimum Health, yeah, it's for all.
Today, we're going to talk about recent advancements or recent advances in the management of heart disease. Um, we need to talk about them because these advances are relatively recent in Nigeria, and there are places in Nigeria where they can be done. Some of them, those people travel out of the country to take advantage of. Now, some of these advances are available in Nigeria in the management of heart disease. Today we have Dr. Iseko Iskeko. He's a consultant physician, cardiologist, and interventional cardiologist. He will talk to us about some of these recent advancements in the management of heart disease. Dr. Iseko, you are welcome.
Thank you very much for having me, sir.
No problem. I think that we are delighted, in fact, we are privileged to have you on our program. So, what heart diseases are we talking about, and what are these recent advancements in the management of heart disease?
So, heart disease have been around for a long time, and the spectrum of heart disease varies quite a lot. What essentially heart disease entail, from heart failure to heart attacks to prevention of sudden deaths, all of these are the spectrum of heart diseases in patients that come around. So, a lot of these new advances are things that are done in what we call a cath lab, where we are able to minimally intervene into the heart through a needle without opening the heart cage. And we can do that in a special room called the cath lab. That way, a patient gets to go home the same day or next day. And these diseases are typically life-threatening. They include heart block, pain, or when people's heart are not functioning as well as it ought to, what we call heart failure. Yes, sir.
Okay, so can we have some examples of practical examples of some of these heart conditions and these advances in heart care?
All right. So, what we're talking about is, for example, a patient's heart rate can be going so slow that they tend to fall down, they tend to faint, they tend to have, just passing out because their heart rates are too slow. A normal heart rate should be between 60 and 90. However, some people's own goes as low as 30, 40, and they feel dizzy, they feel lightheaded. Sometimes they collapse when they're just standing. So in such a situation, what we do is we put a device called a pacemaker. Now, a pacemaker is something like this. It's a little bit smaller than this. This is a much more advanced pacemaker. A small device, much smaller than this, about half the size of this. We put that pacemaker right here under the collarbone. And once we put it under the skin, we get a lead, something like this, a wire. We pass it into the heart through a vein here, and then we connect it to the pacemaker. Once we have done the connection, then we program it. So we connect to the pacemaker just like this. This is put under the skin. This goes into the heart. Then we close it. The patient looks normal. Nobody can see it. If we finish that within 60 minutes, they go home, and after a while, they can live almost a normal life. This device now begins to sense what the heart is doing, pace it to beat at a proper rate, increase at the right time, reduce at the right time. And when it feels the heart is beating normally, it will also calm down and allow the heart. So yes, so this is one of the kind of devices that we put in the heart. Now this device typically, the battery typically lasts about 10 to 13 years. And before then we'll get warnings when to have to change it as we ought to do from time to time. So this is one of such advances that has been put up and is available in Nigeria for patients.
Okay, now there are other devices that are used, for example, patients who have heart failure. We talked about heart failure before on this program. And so when the heart is not performing optimally or it's not performing enough sufficiently to supply blood to the rest of the body and provide nutrients for the
Yes.
body. So we use drugs to assist the heart to do. We take care of the underlying conditions, but they also sometimes need some cardiac devices. What are these devices?
Okay, so when patients have heart failure, the heart is not functioning as it ought to. In addition to drugs, when the heart failure is advanced, some of these people are at risk of one, sudden death. That's because the heart may beat abnormally and could cause the heart to stop. They are also at risk of having what we call arrhythmias, severe abnormality of the heart that could cause them to have strokes and other things. So what we do is quite a device similar to the heart pacemaker, which is exactly this device. This is a CRTD. Only that in this kind of device, we have three wires coming from this device, going to different parts of the heart to try and synchronize the heart electrical activity to pump in a way. Now, when done, and for the particular patients that require it, they typically get improvement in their symptoms. And objectively and scientifically, we have proven that such people live longer because when those things happen, the device senses it and treats it. So the device acts like a guardian angel device. So there are two types we use in heart failure when the heart is not functioning properly. One is the CRT, which is the biggest device. The other one is the ICD. You know, when you watch all those movies where they say shock, so this device is there. It is constantly checking the heart, constantly. When it feels something abnormal, it can do one of four things. It can pace the heart, it can become a pacemaker. It can raise the heart rate higher than the abnormal beat rhythm to take control of it. It can give a shock at a particular time called a cardioversion, a very low voltage shock. Or it can give a higher voltage shock called a defibrillation when the heart is extremely abnormal to bring it back to normal. So the person could be walking around when they would have just fallen down and died, or somebody would have said is remote control from the village. This device will have picked it up and treated it. So the device acts like a personal doctor inside their heart, and then we take it from time to time. We connect to a computer, an iPad, and we check what has been happening. It tells us everything that went wrong with the heart, how many times it treated, what kind of treatment it delivered, and perhaps also suggest to us what kind of drugs we need to give the person to improve their heart function. And it's really revolutionary for patients.
Okay, thank you very much. But these devices are not meant for persons who don't have heart disease.
No, not for all of them. So a
Okay,
few people are at risk for sudden death.
okay.
They may not have obvious heart disease, but simply because they have a family history of heart disease, sudden death, and they have certain things on their ECG, on their echo, which is an ultrasound of the heart, that suggests they may be at risk of suddenly dying. Some of those people will need to put a device. For example, the footballer in Manchester United, Christian Eriksen, who while playing football and has been an athlete all his life, fell down suddenly while playing football. It looked like he didn't have any heart disease, but he now has to have one, and he has continued playing
So
football,
you had a device which is helping him to continue.
which is helping to continue
Okay,
his
so it's not only for ill people. Can it be? Can, for example, can I put it in my heart so that I can prevent sudden death?
not if you are already at high risk. Otherwise, it will be a waste and to just increase risk. So if there's no specific indication that tells you that this person is at a higher risk of sudden unexplained cardiac death, then we now put a device for such people.
So it's not because I have plenty of money. I go and
No,
get
no, no, no,
ensure
no.
that every member of my family has a device.
Because they could die for other reasons. So this one is only for those that have a cardiac
So there
condition.
must be an indication, a clear
Exactly. A
indication.
clear, and you do that only by having a checkup and going to your doctor. When your doctor checks you and he sees certain things and parameters, typically he may refer to a cardiologist who will now say, okay, you probably need this device. Get evaluated and we might put a device in.
Okay, these devices are good and they seem to be a new way of managing heart conditions, cardiovascular disorders, cardiac disorders, and so on. Are there any downsides? Do they have side effects, for example? We know that drugs have side effects.
Yes.
Do these devices have their own side effects?
Well, everything may have some side effects, but typically the effects of these devices behaving abnormally is extremely rare. It's less than 0.001%. Now, while putting in the device, the risk of having a complication while doing any procedure is also less than 0.5%. So apart from that, there's really not much. When somebody needs it, it's really life saving. But these are not the only kind of devices. These are
But there
devices
are
for,
others.
there are others. We also use certain kind of interventions when somebody is having a heart attack. They're having chest pain. We might have to go into the artery, open up the blockage, and put a small metallic tube to keep that
The
blood
one they
vessel.
call a stent.
That's what we call a stent.
Okay.
To keep that blood vessel open and blood flow, chest pain goes down, patient feels better, and no need for open heart surgery for those people.
Very good. So thank you very much, Dr. Iseko.
Thank you
I'm
very much,
sure
Prof.
our viewers will benefit from getting to know these things, these devices that are available. Are they expensive?
Better soup. That money killer.
So it is expensive.
It is. So a lot of these devices are quite expensive. They're not produced locally. They have to be imported. They have to be programmed. So a lot of these devices are maybe expensive. They're not produced locally. They're produced, most of them, in the US. They have to be programmed. They are massive computers, heavy computers. So yes, they could be quite expensive, and they last for 10 years without any extra charge. So you can imagine.
So thank you very much.
Thank you, sir.
Very grateful, delighted, all the way from Abuja, Dr. Iseko Iskeko.
Thank you for having me, sir.
Thank you. Viewers, you heard it all. Please let us ensure that we subscribe to this channel so that we continue to have updates like this and others that will come your way. You will be the first to know when we have a new program, a new episode. Subscription is free. Thank you. Bye for now.
Optimum health for all, for all, for all, for all. We're building up strong so we never fall. Mindset, power, we're standing tall. It's optimum health, yeah, it's for all. Knowledge is wealth, so we pass it on quick. From the food to the mood, we be flipping the script. From gut to brain, everything aligned. When you live that good life, it's a powerful sign. Balance is the mission, get the vision on deck. Cut the stress, no mess, keep the wellness in check. We thrive, we shine with every routine. Optimum health, you know, but I mean. Optimum health for all.